Hello, my name is Steven, and my other group members are Joshua, Cecilia, Luana, and Hannah, and I'm from the skeletal muscle learning community. And today I'm presenting to you on tendon, specifically its structure, function, testing, and pathophysiology. So let's get started. First off, I'll start off with its structure. So tendon is a dense fibrous connective tissue, primarily composed of collagenous fibers. The primary cell types of tendons are fibroblasts, including tenoblasts and tenocytes, which account for 90 to 95% of all the cells in a tendon. Other cells such as endothelial cells, mast cells, and vascular cells account for the rest. And these other cells are responsible for functions such as supplying fibroblasts with nutrients and oxygen or carrying out immune responses. So tenoblasts are ovoid shaped. They're immature tendon cells. And as they mature, they developed into those elongated shaped tenocytes. And tenocytes are responsible for producing the extracellular matrix made of mostly collagen fibers, and also some other compounds such as proteoglycans and other proteins. So if we actually weigh tendon tissues, excluding the water, collagen fibers alone account for around 80% of the dry weight of the tendon. So tendons have different shapes and sizes depending on the role of the muscle. Muscles that generate a lot of power and forces tend to have shorter and wider tendons than those that perform more fine and delicate movements. So next, organization. So for tendons, the basic unit is the primary collagen fibers. And the basic unit is even broken down further into bunches of collagen fibrils. And the primary fibers, which is the basic unit, are grouped together into primary fiber bundles. And groups of primary fiber bundles form secondary fiber bundles, which then group together to form tertiary fiber bundles. And a group of tertiary fiber bundles form a single tendon unit. And as we can see, this is a very hierarchical structure. The primary, secondary, and tertiary bundles are all surrounded by a sheath of connective tissue known as the endotenon, and it produces synovial fluid to help lubricate and facilitate the gliding of bundles against one another during movement. Endotenon is contiguous with epitenon, which is the outermost layer of connective tissue that encases the entire tendon unit. Next, move on to the functions of tendons. And since tendons are very dense with an intricately arranged hierarchical structure, they are very durable and flexible, which allow them to transmit large mechanical forces. So for a single tendon, one end of it is attached to muscle at the musculotendinous junction, or MTJ, while the other end attached to the bone at the osteotendinous junction, or OTJ. Tendons help relay the mechanical forces generated from muscle contractions to the bones in order to elicit movement. And the sliding mechanisms of bundles allow the tendons to change to the correct shape as the muscles contract, giving it extra flexibility. In addition, tendons are flexible so that it can bend at joints, as well as acting as a damping tissue to absorb shock and limit potential damage to the muscle and joints. Next, for testings. So many tendon pathophysiologists can be diagnosed by a simple physical exam because the symptoms are well known. And a common example is Achilles tendon rupture, and it can be diagnosed through the Matlis test. The Matlis test is performed as the patient lies in a prone position, which means that flat on the chest for the patient. The patient's knee is then flexed actively or passively to 90 degrees, with both feet and ankles in a neutral position. When the foot points away from the leg or in a plantar flexion, the test is negative. And when the foot points towards the shin or in a dorsiflexion, then the test is positive. So, for example, in this picture, the ankle in the foreground is more dorsiflexed, as we can see it's pointing towards the shin compared with the foot in the background, which is in a plantar flexed position, like pointing away from the shin. So the ankle in the foreground indicates the possible presence of Achilles tendon rupture. Moving on. So when a doctor needs a better understanding of what is exactly wrong with the tendon, they will perform imaging on the tendon. So sonograph is the most commonly used imaging technique for tendon pathophysiology because it is non-invasive, fast, cost-effective, and provide accurate diagnosis in most cases. During a sonograph exam, the ultrasound gel is applied to the exposed area, while the transducer, which is basically a handpiece that produces the ultrasound, is moved around the area of interest to capture static or dynamic images on the screen. So for example, in this video, it actually shows a longitudinal view of the Achilles tendon during a dynamic ultrasound exam. So I'm going to play it. And as we can see, there's a rupture here that can be clearly seen as the patient is gently flexed and dorsiflexion or plantar flexion. Okay, let's move on to the pathophysiology involving tendons. So other than the well-known Achilles tendon rupture that I just talked about, some other lesser-known conditions also involve tendon issues. So tenosynovitis is one of them, and it is the inflammation of the synovial membrane in the tendon sheath. It is usually accompanied by pain, sensitivity to pressure, impaired movement of the area, and etc. So for example, in this figure, the patient cannot straighten this finger after bending it due to tenosynovitis. And tenosynovitis can be caused by uh, some different causes. So one of them is autoimmune disorders. Multiple studies have shown that there's a strong link between rheumatoid arthritis and tenosynovitis because rheumatoid arthritis actually preferentially affect synovial linings. Infectious pathogens can also cause tenosynovitis through proliferation within the tendon sheath. And these pathogens include Staph aureus and MRSA. Most commonly, though, tenosynovitis is caused by overuse, such as playing an instrument, wearing poorly fitted shoes, or typing on a smartphone. And those repetitive motions actually put mechanical strain on the tendon, leading to microruptures and inflammations. The areas that are particularly affected are hands, wrists, and feet. For treatment, it varies by the causes. So for infectious pathologies, treatments depends on the specific pathogen responsible, but usually a broad spectrum antibiotic is prescribed for most cases. And for other causes, resting the affected area, massage, and anti-inflammatory painkillers can all help. And in those most serious cases, surgery is needed to remove the affected tendons. And another condition involving tendon is Marfan syndrome. It is a very rare inherited systemic disorder affecting the body's connective tissues, including tendons. So patients usually exhibit a range of symptoms depending on which part of the body is affected. It can include tall, thin build with long arms, legs, fingers and toes, flexible joints, flat feet, as shown by this figure right here. Heart issues such as heart murmurs and aortic bulging could also take place. So Marfan syndrome is caused by this mutation of the FBN1 gene on chromosome 15. And this gene codes for fibrillin 1 protein. Fibrillin 1 protein bind together to form microfibrils, which join together to form fibers that give elasticity and support to connective tissues. So when fibrillin 1 proteins are defective due to FBN1 mutation in Marfan syndrome, there's a decreased number of microfibrils formed, and it causes less elasticity in those tissues. So for treatment of Marfan syndrome is dependent on the symptoms an individual exhibits. So it varies from person to person, depending on which body systems are affected. If tendon abnormalities are the significant problems, then those are generally irreversible situations, but the symptoms can be alleviated or can be prevented from worsening by physical therapy exercises. Otherwise, there's no cure for this disease. So here are my references and concluding my presentation. And thank you so much for your attention.